welcome everybody. It's an honor to speak in front of you. And my name is Michal Wäger. I studied biochemistry, did a little bit of research in Australia as well regarding bioinformatics and genetics. And I'm currently the scientific head of the Biogena science team. Today, I would like to talk about selected micronutrients in long COVID. Why, you may ask? I think it's kind of similar in the US as well in Austria and in Europe in general. A lot of medical doctors and therapists don't know how to, or which supplements they should recommend, or how they should use supplements in their long COVID therapy. And I would like to, and I would love to give you like kind of a special recommendations based on the most recent studies regarding the therapy of fatigue syndromes, fatigue symptoms, as well as long COVID in general. So hopefully everything is working. One sec. Yeah. So in the beginning, I would like to talk about a little bit about the general facts about long COVID. So as you may know, there's a huge variety in possible symptoms of long COVID. For example, you have this extreme tiredness, so this fatigue, you have shortness of breath, you have chest pain, people have problems with their memory and their mental focus, and there's also this so-called brain fog. Additionally, obviously, they have sleeping problems and so on and so on. And all those symptoms accompany COVID-19 patients for a really long time. So, for example, even 2 months after the onset of the symptoms, over 40% of the patients report a poor quality of life. And symptoms, and that's basically the lead symptom, fatigue, can even be found after 6 months after the onset of the symptoms of a COVID-19 infection. And I think medical doctors and therapists agree that the so-called, let's say, micronutrient malnutrition really contributes to this impaired or delayed recovery process. And today, I won't talk about the immune classics like, I don't know, vitamin C, selenium. I think everybody of you is an expert with the classics. I would like to talk about, let's say, insider tips and special recommendations regarding ashwagandha, so Withania somnifera, ubiquinol, so Q10, NADH, as well as omega-3 fatty acids. My first personal recommendation for the supporting treatment of long COVID is obviously ashwagandha. It's also called Withania somnifera. I think most of you know ashwagandha because of its adaptogenic properties. However, for COVID-19, the immune supporting as well as the antiviral properties are even more exciting, in my opinion. And when you're having a look at the studies from the last 2 years, you can really see that ashwagandha is able to inhibit the SARS-CoV-2 entry into the cell. As well, it also inhibits the replication of the virus in the body. And I think of particular importance is the so-called triplex effects of the active ingredients of Withania somnifera. So that's the withanolides. And these key mechanisms are, on the one hand, the general immune supporting effects of withanolides. Then you have the antiviral properties, as well as the anti-inflammatory properties. And those properties really lead or have shown that, or have caught the interest of researchers in the last years. And they wanted to have a look how well the withanolides act as possible drugs for the treatment of COVID-19. And the aim of the study really was to investigate if specific withanolides are able to bind to different target proteins, like, for example, the 3C-like protease, so 3CL-Pro, the papain-like protease, or the spike protein in general. And all those proteins are really essential for the viral replication and the translation processes of the coronavirus. And what you can see on this slide, so we'll go a little bit into detail regarding this drug likeness study. You can see 17 different withanolides that you can find in ashwagandha, in Withania somnifera, and all of them have been investigated for possible drug likeness scores. And as you can see, I highlighted 4 of them. So withanolide G, withanolide M, D, as well as Q. And those gave the most promising results. For example, when you have a look at withanolide G, which you can see on the left side of the slide, withanolide G really was predicted to modulate the highest number of proteins, in particular those which influence vascular health. And it also showed a really good human intestinal absorption and was predicted for the highest drug likeness score. Additionally, I would like to talk about withanolide D as well as G. Those 2 withanolides were predicted to have a better binding affinity with the already mentioned papain-like protease, and withanolide M had a good, let's say, compatibility with the 3CL-Pro as well as the spike protein. And everything is based on like the binding energy as well as the amount of hydrogen bond interactions. And finally, this study really showed that selective ingredients of ashwagandha are able to inhibit COVID-19 and to boost the immune function in general. And this was really the starting point why more research got into ashwagandha regarding long COVID. But I will come into that on the next slides. What about Withania somnifera and long COVID? Because that's why everybody of you is here in this talk. Really underline the supporting effects of ashwagandha in people with long COVID, specifically with anxiety symptoms, and this, for example, chronic stress-like symptoms. I would like to mention this study, which you can see on the slide. This is a randomized controlled trial. They used 240 milligrams of ashwagandha extract over a course of 60 days. And what's really exciting, I think, is that this intervention with ashwagandha really showed that it is able to decrease cortisol levels by 23% and DHEA levels by 8.2%. And at the same time, testosterone in men was increased by 10.6%. And this is really particularly important because in chronically stressed people, those hormones show imbalances, and ashwagandha seems to rebalance this disturbed metabolic profile. And additionally, anxiety decreased by 41% after the intervention with ashwagandha. So here, all of the symptoms which also occur in long COVID can be treated, which was really shown in this placebo-controlled study. And I already mentioned that fatigue is like the main symptom for long COVID. And here I mentioned or I show you a study which really had a look into this kind of symptoms and tried to treat it with 600 milligrams of ashwagandha root extract over a course of 8 weeks. Again, it's a randomized controlled study, so there is also a placebo group to give the study even more evidence. And here I would like to focus on the fact that people with long COVID often show a general sense of being unwell after even minor physical or cognitive exertion. And as you can see on the slide, after the intervention time of 8 weeks, stress management and recovery improved radically because of ashwagandha. And when you're having a look regarding at the fatigue symptoms, ashwagandha showed an improvement of 60% in comparison to the placebo group with only 2%. Additionally, the lack of energy was improved by significantly 46%, thanks to the intervention with ashwagandha, so Withania somnifera, in comparison to only 0.3% in the placebo group. Therefore, ashwagandha really shows promising effects in therapy for one of the main symptoms or the leading symptom in long COVID. And I think this was for me the most exciting website I found a few weeks ago. So at the moment, they're doing or planning a huge study with over 2,000 people It's a cooperation, so it's done in the UK, and it's a cooperation of the London School of Hygiene and Tropical Medicine and the so-called All India Institute of Ayurveda. And as you know, the UK was like one of the most important countries during the pandemic and also in the first few months of the pandemic. And therefore, the ministry really wanted to do research regarding the treatment of long COVID. And what they are planning at the moment, they're looking for 2,000 people with long COVID, with ongoing long COVID. One group with 1,000 people or 1,000 participants will get 500 milligrams of ashwagandha extract, and the other group a placebo. The duration is only 12 weeks, so 3 months. It will be a double-blind trial, and they have a look at typical quality of life parameters. They will have a look, will daily activities after the intervention increase thanks to the supplementation with ashwagandha? And what about mental and physical health symptoms? They started the recruiting phase in August. I just had a look today and yesterday about an update. They're still recruiting because I think it's not that easy to find 2,000 people which basically fit together, all having long COVID. But one of the authors said that I think in summer, they will finish the study and the results will be published. So stay tuned for more. Oh, did I jump? No. So the first few slides have been about ashwagandha. Now I would like to switch to coenzyme Q10 or ubiquinol and NADH in chronic fatigue syndrome. So NADH is nicotine adenine dinucleotide. And as I already mentioned, long COVID really shows striking similarities with chronic fatigue syndrome. So for example, symptoms of chronic fatigue are shown in 50% who had severe COVID-19 symptoms and were hospitalized. Additionally, roughly 1/3 of the people with symptoms but without the need of hospitalization also show chronic fatigue symptoms. And what's the most shocking for me, in people who were asymptomatic, still 19% show chronic symptoms of fatigue. And this led to this slide basically. So scientists are now proposing that long COVID could just be a synonym for chronic fatigue syndrome. And since the symptoms are that similar. So I think in August and October, you could find a lot of headlines in the media, and a lot of researchers tried to find those similarities. And I think it's also let's say, a win-win situation for people having chronic fatigue syndrome. And there are those people. There was a time before Corona, before COVID-19. And I think the more research goes into that, and the more money goes into this research, the more those people can be helped in the future. Now back to Q10, ubiquinol, as well as NADH in this lead symptom fatigue. So since mitochondrial dysfunction as well as disturbances in the redox status of the cell are discussed as a possible pathomechanism for chronic fatigue syndrome and long COVID, Q10 and NADH could play a key role in the management of both diseases. And I had a look into the existing evidence, and I also talked to medical doctors in Austria, what they were thinking about Q10 and ubiquinol, because obviously we know that Q10 has an important role in the energy metabolism in the cell. And NADH can, for example, increase mental performance. But what about chronic fatigue? And what about the studies in general? And I found one interesting study from last year. This study really combined NADH as well as coenzyme Q10. And this study, again, was in RCT, and they used 200 milligrams of coenzyme Q10 as well as 20 milligrams of NADH or a placebo over a course of 3 months. So they had a look into fatigue symptoms, and they measured those fatigue symptoms with the so-called fatigue impact scale, so the FIS-40. That's a standardized and certified questionnaire. And the secondary endpoint was basically sleep quality, which they measured with the so-called Pittsburgh Sleep Quality Index. And they also had a look at general quality of life and how they will change over the course of the 12 weeks. This was done with the 36-item short form health survey. And as you can see on this slide, after the 12 weeks intervention, the cognitive fatigue perception really got better. So the general quality of life improved, and the sleep duration and the sleep quality in general were supported by the combination of NADH as well as coenzyme Q10. And I think that those results really show that you should recommend this combination when you have, it doesn't matter if it's long COVID or if it's people with chronic fatigue syndrome. And here we really have the evidence. 200 milligrams of coenzyme Q10 and 20 milligrams of NADH is, in my opinion, at the current state of research, the way to go. And I also had a look at 2 other studies which confirmed those studies as well. Those studies were from 2015, and I also cited them on this slide. But obviously, I also would like to talk a little bit about the raw material, because it doesn't matter if you just buy any Q10 on the market or any NADH on the market, because you want to give your patients or your clients the best supplement available, and therefore you have to have a look into quality on the one hand and stability on the other hand. So for example, when you look at the left side of the slide, you can see that ubiquinol exists, or Q10 exists in 2 different forms. So the white powder is basically the ubiquinol, the reduced form, the more active form, and you have the yellow powder, the ubiquinone, the oxidized form. And it's important to know that the ubiquinol, its bioavailability and its, let's say, efficiency is 3 to 4 times higher than ubiquinone. So you have to keep that in mind. Therefore, ubiquinol for daily therapy is the superior form and should be your way of choosing a Q10 form. And I think regarding the topic of ubiquinol, it's really important to choose a reputable as well as certified manufacturer, since a lot of fake products are also obtainable on the market. I think it was 1.5 years ago, it was published on nutriingredients.com that they did so they bought basically all different Q10 supplements worldwide on the market, which claimed that they had ubiquinol inside. But I think 85 or 89% were fake. There was just ubiquinone, so the oxidized, less bioavailable form in the capsule, in the products. So therefore, please look out for reputable companies. For example, we are using and working with the market leader of Q10 of ubiquinol, that's Kaneka from Japan. And Kaneka is basically the only company who has a patent on the whole stabilization process. And as far as I know, they are the only company which are able to really guarantee that there's ubiquinol in the capsule and that ubiquinol. And normally, you can check also by yourself if you just open the capsule, which color it has. But please, for example, there are also, let's say, black sheeps on the market who use ubiquinol and a lot of titanium dioxide. So that's like this white powder to basically fake the Q10 content. And their aim is that they that the buyer, the consumer, thinks that ubiquinol is contained. So please keep that in mind in everyday therapy. Additionally, I would like to talk a little bit about NADH, because I didn't know about this as well. I think I know it now since 3 months, because I was like, okay, NADH is NADH, it doesn't matter which one I choose. However, there seems to be a huge issue with instability regarding common NADH. You can see, for example, on this diagram that after a shelf life, so just imagine you buy a product, And after 6 months, when you buy a common NADH supplement for your daily therapy for your clients and your patients, the content really goes down. There's a drastic reduction up to 0%. And basically after 6 months, there's nothing, no NADH contained in the capsule anymore. And the thing is, so that's the one thing. The other thing is that if you don't protect the common NADH that you can find in the market via, for example, microencapsulations or additional stabilization processes, it will be broken down thanks to the gastric acid in your gut, as well as oxidation processes. And we work with a Austrian producer. They're called Panmol, and they really they're in Europe. Speaking for Europe, they are the only brand which produces NADH, which also shows stabilization data after, in this case, it's 35 months shelf life, and they also show that after the gastrointestinal metabolization, that the NADH is still stable and can be absorbed. So therefore, we are using the Panmol NADH instead of common NADH, and this product will be launched in the next few weeks. So stay tuned, please. Last but not least, I would like to talk about omega-3 fatty acids. And as a medical doctor or therapist, you need to consider 3 things in your day-to-day practice. So in the first place, you need to know how your patient, your client is supplied. I will get to this on the next slides. The second thing you have to know is about the metabolic challenges you will face in therapy. And thirdly, you need to know about the respective role in COVID-19 and long COVID from the omega-3 fatty acids. I would like to start with this slide. I think many of you know the Omega-3 Map, which was published by Stark et al. In 2016. So they had a look globally on every study they could find, which measured the omega-3 index, the omega-3 status, and then they created this Omega-3 Map. And speaking for the US, it's kind of as bad as in Austria. You can see that a lot of people, almost all of the people have a really low omega-3 index. And you know, the lower your omega-3 index is, the higher is your cardiac risk in general. So please keep that in mind, because that's also relevant for an ongoing COVID-19 infection as well as long COVID. And you really need to aim for an omega-3 index of 8 to 11. I will come back to that in the next few slides. But as a matter of fact, at the moment, speaking for US, speaking for Europe, it doesn't matter. Almost every country has a too low omega-3 index. There are a few exceptions, for example, but only countries with let's say, a big tradition in catching fish and eating fish, like, for example, Japan. You can see on the right side of the shown map, only those people have an omega-3 index which is greater than 8. So yeah, keep that in mind. And it's really important to measure the omega-3 index. There are a few methods you can do. Obviously, you can just take, for example, whole blood of the patient and measure it. But there's a simpler method which is as good. So you can just buy a self-test kit. And you have to take like only 1 drop of blood of your fingertip, put it on a piece of paper and send it to the lab. Therefore, it's really easy for the customer, for the patient, for the client to do it. The compliance is really high, and the scientific evidence behind it is really, really good. So it doesn't matter if they take like a classical lab test or if they do this self-test. And speaking about let's say the levels of the omega-3 index, we did, so Biogena and our science team, we did the almost 1 year ago, we did the so-called Biogena Good Health Study. This really was, or still is, the biggest study regarding good health and well-being in all the German-speaking countries here in Europe. We had a look at the lab profiles of 1,377 people, so men and women in Austria, overall age groups, and we had a look at every vitamin or micronutrient which was available. We had a look at cholesterol, omega-3 index, homocysteine, blood pressure, and we also evaluated 5 different standardized questionnaires regarding stress, resilience, sleep, depression, and general well-being. And we will just publish the first part of the document, I hope, next week. So we're a little bit late, but let's say the results are, they are impressive. But that's just a small cliffhanger. But what I wanted to show you on this slide is how well are the Austrians supplied with omega-3. And I checked it with the US. It's basically the same. It's, I think, 5% more or less. And you can see that in general, almost 90% show an index that's smaller than 8. And this also really is one of the reasons why, for example, heart attacks are that bigger topic in Austria and Europe and in Western countries as well. And we have a particular big problem, or we see a particular huge problem in vegans as well as vegetarians. And flexitarians, they have a omega-3 index from 6 to 6, so they have like this moderate protection. But if you're going for a vegan lifestyle, please have a look at your omega-3 index. But there's also good news. We also had a look at those people. So we asked them, okay, are you using supplements? Which kind of supplements are you using? And we could really show that people who used omega-3 supplements had an average index of 7.1 in comparison to an average index of 6.0 from those without taking any supplements. The second thing I would like to mention is the already mentioned metabolic challenges. So those you need to face in daily therapy. So if you have a patient or a client with omega-3 deficiency, this is particularly important for you, especially if you have a patient or a client who is a vegetarian or a vegan. Because if your patients, or if you may be thinking, okay, I will just use more linseed oil or hemp seed oil to increase the omega-3 index, you may be puzzled when you don't achieve any effect or only small effects, especially men. The reasons for this you can see on this slide. I will start with the first issue. So you have to know when you're taking, for example, linseed oil or hemp seed oil, the omega-3 source is alpha-linolenic acid, obviously. And this has to be metabolized to EPA and then to DHA, and then goes into all those eicosanoids, into resulfins, and so on and so on. And you have to know that 15 to 35% of the alpha-linolenic acid is directly used for energy production. But please consider that. It won't go into EPA and it won't go into DHA. Still, it goes directly into energy and into your caloric intake. That's just how the body works, sadly. The second thing I would like to mention is, and that's really bad news for men. Men really have a low metabolization rate regarding the metabolization of ALA to EPA and then DHA. As you can see on the slide, when you want to metabolize alpha-linolenic acid to EPA, the metabolization rate is only 0.3 to 8%. And the whole metabolization rate in men is often not detectable at all. There's good news for women. This metabolization process works better in women. So we have a metabolization rate of ALA to EPA up to 21% and up to 9% from ALA to DHA. So please keep that in mind when you're thinking, okay, I will just use plant-based ALA, omega-3 fatty acids, to increase my omega-3 index, and it doesn't work. That could be the reasons. The next thing I would like to stress is that high levels of linoleic acid in the diet compete with ALA metabolization. So if your diet consists of fatty meat, junk food, and so on, you have like a huge amount of the omega-6 acid, linoleic acid, and this really competes with the metabolization rate of ALA. The last thing you need to consider is when you have a really high intake of ALA, this directly leads to an increased oxidation process and a decreased metabolization to EPA and DHA. So when you're drinking, I don't know, a huge bottle of linseed oil, there's a huge chance that your omega-3 index won't increase in time. So please consider, doesn't matter if it's, I would say plant-based omega-3 fatty acid sources, supplements, which directly contain EPA and DHA from algae, for example. What's the role of the omega-3 fatty acids in COVID-19 and long COVID? So, as you may know, I already mentioned the eicosanoids. Those are critical mediators in inflammation that appear to be involved in the often cited cytokine storm. And this is confirmed by in vitro models, for example, which demonstrated that virus-induced inflammatory proteins alone lead only to a small increase in those eicosanoids, for example, interleukin 6. If, however, eicosanoids such as prostaglandin 2, so PGE2, were present at the same time, IL-6 and therefore the cytokine release was several times higher. So what means that for daily therapy? Elevated levels of pro-inflammatory cytokines appear to strongly influence the severity of the symptoms of COVID-19, restoring the balance of pro-inflammatory and anti-inflammatory eicosanoids could help and could regulate the cytokine storm. And how can you regulate this balance? You have to supplement omega-3, or you have to increase the omega-3 index. You have to eat more EPA as well as DHA. And therefore, you could really interrupt the cytokine storm. And please also keep in mind the positive effects of omega-3 fatty acids on blood coagulation in general. Because, for example, a recent study reported that individuals who died as a result of a COVID infection consistently exhibited symptoms of blood clotting disorders. Here, supplementation with high-dose EPA as well as DHA could help to ease those symptoms and reduce the risk of death and really support your microcirculation. Regarding long COVID, you have to think about chronic fatigue. And a lot of studies really show that people with chronic fatigue syndrome and with this chronic stressed metabolic balance rate have a really low omega-3 status and therefore a really low omega-3 index. Two more facts I would like to mention about omega-3. So you should aim for an omega-3 index between 8 and 11. And you really can adjust the dosage because the aim is really to go for 8 and 11. I would recommend, for example, a self-test every 3 months till you get to the omega-3 index of 8 or 11. My general recommendation for a general prevention is between 1 and 1.5 grams of EPA and DHA. So not only omega-3 fatty acids like linseed oil, really EPA and DHA. And I think a few of you will think, okay, there could be interactions with blood thinning drugs. Yes and no. Based on the most recent safety assessment of the European Food Safety from the EFSA, the agency, therapeutic doses up to 5 grams, so 5 grams of EPA and DHA can be used and are saved. So up to 5 grams, there is no interaction with blood thinning preparations at all. So just use 2, 3, or 4 grams of EPA and DHA to really drastically increase omega-3 index to support your patient and your client. So to sum everything up, I think, and that's a good thing, more and more therapeutic strategies for long COVID emerge in scientific literature and day-to-day practice. And as you've seen in the last 30 minutes, selected micronutrients and plant extracts really can help to ease the symptoms, to support different pathomechanisms. And finally, my personal recommendations, also based on the studies and also based on my talks with our partner doctors at Biogena, I recommend ashwagandha up to 10 weeks with a dosage of 600 approximately milligrams per day. I would recommend a combination of ubiquinol and NADH. So 100 to 200 milligrams of ubiquinol and 20 milligrams of NADH up to 12 weeks. And obviously, you have to aim for a omega-3 index of 8 to 11. So please just use a combination of EPA and DHA up to 5 grams. Therefore, you can also you won't have any interaction with blood thinning agents, and your patient and your client will have like a really high compliance. And in the best case, the symptoms will and can be eased. So that's it from my side. And I think now I'm happy to answer all of your questions. Thank you.
Thank you so much, Michael. Yes, we are now in the Q&A portion of this webinar. Just a reminder to ask your questions, please enter them in the chat box and hit submit. We have a question here. Are there any contradictions to supplementing with NADH?
No. So because I knew that this question will come, so we have 2 pharmacists in the team. I talked to our, let's say, our leading pharmacist, and he said, no, we couldn't find, because we did a safety assessment, and because obviously we only want to develop products which are safe, and he couldn't find any interactions with drugs. So NADH is definitely safe, and there is no interaction in any book, in any literature that you can find.
Thank you. Our next question is ashwagandha tea valuable?
The thing is, yeah, you could use it as an additive, but the question is how many withanolides are in the tea? Because when you're using, for example, an alcoholic or a water-based extract from ashwagandha, from the root, you have like a higher degree and a higher amount of the active ingredients in your extract. So yeah, you can drink, I don't know, 2 liters of tea every day and hope that your withanolide amount is high enough. But I would use a supplement, because then I know, okay, they have a standardized content of X% withanolides in the supplement, and you know what you're getting and you know what you can expect. But yeah, obviously, as an additive, it can help, definitely.
Thank you. Our next question, what is the recommended ratio of EPA DHA?
The recommended ratio. So the thing is, we are using, or what our medical doctors are often using, is like a ratio from 2 to 1, so EPA to DHA. So basically, you have a lower amount of DHA, which you are prescribing, and a higher amount of EHA. But it's between 2 to 1 or 3 to 1. Yeah. But all in all, it's more important to achieve this total amount of EPA and DHA, because as I showed, EPA can be metabolized to DHA in a highly efficient way. And yeah, the total amount of EPA is really important for the omega-3 index. But regarding your question, it's 2 to 1 or 3 to 1.
Hi there. Sorry about that. We have a couple questions that came in. Are your personal recommendations for both long COVID and CFS?
Pardon?
Are your personal recommendations for both long COVID and CFS, chronic fatigue syndrome?
If they are the same?
Yes.
Yeah. Because the symptoms are basically the same. It doesn't matter for me, and that also shows the literature that when you want to help in fatigue, you can basically use the same dosages for the same amounts because the diseases are that similar.
Got it. Our next question, again, sort of a similar question from before. Any risk in ashwagandha with blood pressure medications like a beta blocker?
Not blood pressure medication, but thyroid medication. So you have with thyroid medications, you definitely have interactions. So when your patient is using them, you have to track the lab parameters constantly because ashwagandha can have an interaction with those levels, but not with any beta blockers, for example.
Got it. And again, any contradictions with taking ashwagandha with autoimmune conditions?
I think it's quite the opposite. So we have a few partner doctors which like their specialty are autoimmune diseases, and they really try to use those adaptogens like ashwagandha, rhodiola, I don't know, cordyceps, reishi, sort of medicinal mushrooms, to really get the immune system back to a baseline. And I know that they are definitely using, for example, ashwagandha in multiple sclerosis, in different diabetes symptoms, in arthritis. So you definitely can use it in people with autoimmune diseases. But again, if they use any thyroid medication, keep that in mind.
Thank you. Our next question, do higher levels of ashwagandha affect IBS or gut issues?
So in my 9 years at Biogenera, I have never heard that. So based on my experience, I would say no. Because I can't think about a biochemical pathway, how it could affect IBS. So maybe if you're using a root, like a powder from the ashwagandha root, and the quality isn't that good, maybe it can, I don't know, stimulate IBS symptoms. But when you're using, for example, a good high quality supplement, a standardized extract, there shouldn't be any issue at all. I've never heard that before. But if you like, I can check with my team colleagues and get back to this question tomorrow.
Thank you. And then we had a question, do we need to review quality of brands online, or does the bottle show root versus leaf or oxidized versus not?
That's kind of a tricky question. So you can see on the label if it's a root powder or an extract. So by law, the producer should write that on the label. However, regarding coenzyme Q10, when there's only coenzyme Q10 on the label, that's basically legal. It's legal in the US, it's legal in Europe. You can do that. But then you as a customer, you don't know if it's the oxidized or the reduced form. So either you buy a product which has ubiquinol in it, or you have to research and maybe ask the producer of the supplements which form they are using. And please, you have to ask for like let's say a analytic specification document because you have to get it like written on paper. And please be skeptic, because with Q10, there's a lot of mischief which brands are doing on the market. So please use one from a branded raw material, and don't hesitate to ask them for any lab reports and analytical documents.
Thank you. Our next question, do you have any experience with chronic lymphocytic leukemia and CPA and EPA and DHA?
I myself, no, I don't, but I can just ask a few of our medical doctors. So is there any specific thing you would like to know? So if it's working, or if there are any contraindications, so just write it into the chat and I can check with our colleagues and our partner doctors.
Great, thank you. Let me see here. Are you able to recommend another adaptogen instead of ashwagandha?
Yeah, rhodiola. So for me, in my personal experience, rhodiola works better for me when I'm stressed out. So rhodiola rosea is really my favorite adaptogen, followed by ashwagandha. Regarding fatigue symptoms, ashwagandha has a better body regarding scientific evidence. But for the classy, let's say, stress relief, I prefer rhodiola rosea because, and also for anxiety in general, on well-being, rhodiola is also quite potent. Yeah, there's a little bit of people or medical doctors and therapists also use reishi, cordyceps, coriolus. They also have adaptogenic properties, but they are not as strong as in ashwagandha as well as rhodiola rosea.
Thank you. Our next question, what is the source of the omega-3 in your product, and is there DPA in the product?
So the source is algae. Which one is it? So I don't know it in English. One sec, please. Yeah, it's algae. It's a microalgae. It's Schizophytrium sp. And it's an algae which really has EPA as well as DHA in it.
Thank you. Our next question, does Biogena offer a vegan omega-3 product?
Yeah, we have actually two on the market. So one with EPA and DHA, which I definitely would prefer, and one with DHA only.
Thank you. I don't know if I'm going to say this right. What dose of the adaptogen is recommended? The rhodiola?
300 to 400 milligrams. Yeah, because that's the I know that because I just used it recently a few weeks ago and had a look at the studies. And I think with 300 to 400 milligrams, you can really have like the highest grade of efficiency in easing different symptoms, stress relieving symptoms, and so on. You can start with 150 to 200, but I would recommend 300 to 400. Yeah, then obviously you have the effect occurs in a shorter period of time. So yeah, I'm staying with 300 to 400 milligrams a day.
Thank you. Do your supplements contain gelatin, and what's the source of it, if so?
So speaking for the vegan omega-3, which I already mentioned, there is no gelatin in it. So no. And also the DHA as well. It's like it's a modified starch capsule, but there's no gelatin in it at all. So no. In the vegan omega-3 fatty acid supplements.
Thank you. We had a few people ask a follow-up just regarding the interaction of ashwagandha with thyroid. Can you kind of go into that a little bit more?
I can just send you like a half-page statement tomorrow if you would like to. I think that's the easier way.
Okay.
Because then you also have like the exact lab parameter you have to look at, and also how much percent the ashwagandha influences the individual parameter, and you can just use it then in everyday therapy. So I can send it out tomorrow, for example.
Great, thank you very much. We'll include that with our thank you emails. I think we have a couple more questions, the last few questions coming in. Let's see, sorry, they're coming in. Someone said, sorry if they missed this, but about the algae source of the omega-3s, but what kind of algae? Is it blue-green or something?
Can I write it into the chat because I don't know how to pronounce it.
Okay.
1 sec.
Great. I'm going to post that to
and
everyone.
It's a microalgae.
Great. Thank you. I think that is our final question. So we're going to wrap up the Q&A. Many of you have asked about the on-demand materials. So just a reminder, everyone will receive a thank you email that will include some follow-up information from Michael regarding the thyroid, and also a recording of today's live webinar so you can play back as needed, as well as a PDF of the presentation. So you will get all of that in one nice email from Integrative Practitioner within 2 business days. With that, I want to thank Michael for your time today. A lot of great information, a lot of great questions. So I want to thank our audience as well. Just a quick reminder to the audience, if you could please fill out the short evaluation form that will appear once the webinar window closes out. Your feedback would be greatly appreciated. And thank you again to Michael for a wonderful presentation. Thank you for all your time you've put into this work. So thank you very much. And once again,
pleasure.
And once again, this webinar was brought to you by integrativepractitioner.com and sponsored by Biogena. And so thank you all and have a great rest of your day.
See ya. Bye.